So today we're going to talk about the veins, mainly the veins and arteries of the lower limb with some Doppler tips and tricks and notes. So to begin with, we need to understand the orientation of the veins in relation to the arteries in the lower limb. So before the knee, above the knee, the veins are always medial to the arteries. So arteries are more lateral and the veins are more medial, right? As we can see here, the common iliac veins in the pelvis are medial, as well as the femoral veins are more medial to their arteries, okay? So this is the first thing that we need to note. Second is when we get to the popliteal area. The popliteal, we're going to find that the popliteal vein is superficial to the popliteal artery, which makes sense because arteries in this critical area need to be more deep, so they're not more liable to injuries, okay? So here veins are more superficial than arteries. We can memorize it by saying that maybe veins are protecting their arteries, okay? So this is one thing. This is going to be important when we do Doppler of superficial veins in the lower limbs. So we need to differentiate between the arteries and the veins in the ultrasound by the anatomy, as well as, of course, the color setting, but we need to differentiate by the anatomy as well. When we get here, also the calf veins, they run alongside the arteries. So anterior tibial, posterior tibial, and fibular arteries, as we are going to see throughout the video, right? They are surrounded by two veins. Each artery is surrounded by two veins throughout the calf muscles, okay, or the calf, okay? Okay, so now let's start. We're talking about the lower limb. So here is let's start with the arteries, okay? Okay, so the lower limb starts with the femoral artery, which is an extension of the external iliac artery. So basically this is the common iliac, right? So the abdominal aorta divides into two common iliacs, and then the iliac. The common iliac gives the internal iliac and then the external iliac. And then right below the inguinal ligament, the internal iliac becomes the femoral artery. And this is where the arterial supply of the lower limb starts. So here is the femoral artery. Sorry. So this is the femoral artery. It gives off a lot of branches, but the branches that we'll see in the Doppler are going to be, so these are a lot of small branches, like the superficial circumflex iliac and the superficial epigastric artery and the peduncules right here. But the main branch is the deep, right? The deep femoral artery, right? Because we're gonna see corresponding veins to these arteries, okay? All these small branches, yes, they're gonna have corresponding veins, but these are not veins that we are able to see in the duplex because they're very small, right? So the major ones, the arteries, we have the femoral artery, gives off the deep femoral artery, or the profunda femoris, okay? And then you can move back, and then the femoral artery will move through the adductor canal, right? And behind the knee, right, to become the popliteal artery. Okay, to become the popliteal artery. And then divides into the popliteal artery will divide into anterior and posterior branch, anterior tibial and posterior tibial. Okay, so this is here the anterior tibial artery, which runs the anterior part of the leg, and then the posterior tibial, which runs in the posterior side of the leg, right? And then the posterior tibial artery, okay, will give off the fibular artery. Both of them run on the posterior side of the leg. Okay, so as we can see here, the posterior tibial has two veins along its side. Here, fibular, two veins along its side. Here, here fibular. Here, the anterior tibial has two veins along its side, right? So the veins of the calf muscles, right? They run corresponding to, so two veins run corresponding to their arteries. Okay. So basically, this is the arterial system of the lower limb. Okay, let's get into the veins, right? So here, again, we have the common iliac veins. They give off common iliacs, they give off the internal iliacs and then the external iliacs. And then after the inguinal ligament, the femoral is a continuation of, or the external iliac is the continuation of the femoral vein, right? So the femoral vein also has small tributaries like the superficial epigastric, circumflex iliac, and the epidendals right here. But the main one, just like here, the main branch of the femoral artery was the deep femoral artery, or the profunda femoris. The femoral vein right here, the main tributary, or the biggest tributary, is the great saphenous, but the one corresponding to the deep femoral artery is the deep femoral vein. Okay, so the deep femoral vein, also known as the profunda femoris, just like the artery, so both are profunda femoris, artery and vein. And also it's called the deep vein of the thigh. So deep vein of the thigh, deep femoral vein, profunda femoris are all names of the same vein, right? So femoral vein and deep femoral vein, or profunda femoris, are the main two veins of the deep venous system of the thigh. The saphenous vein, of course, is a major tributary of the profunda femoris, but it drains the superficial venous system, so it's not part of the deep venous system that we scan in the Doppler. Okay, so here we have the femoral vein and deep femoral vein. It's nice to note that here in this section we can view a Mickey Mouse sign on the ultrasound, right, having the femoral vein as the head of the Mickey Mouse sign, and then the great saphenous is the let's say the medial ear, because here on the left leg it's gonna be on the right. I mean, it depends on the orientation of the probe, but let's say it's gonna be the medial ear, and and then the lateral ear is going to be the femoral artery. So the Mickey Mouse sign is made out of the femoral vein, femoral artery, and great saphenous vein. Okay. So this is the only time we're going to mention the great saphenous vein in the Doppler scan. Okay. So here the veins are medial to the arteries until we get into the popliteal fossa. The popliteal vein right here. The popliteal vein right here is superficial to the popliteal artery. Okay. So here we're going to see on the ultrasound screen, we're going to see the popliteal vein on the upper side of the screen, and then the popliteal artery below the popliteal vein on the screen. Okay. Here it's also okay. Then we have the popliteal vein, right? It divides into anterior and posterior. So anterior tibial, right? And then posterior tibial, and then the posterior tibial gives the fibular veins, right? So it's the same division, okay? So now that we know the divisions, let's go again to the upper part of the lower limb, and let's see how the Doppler scan. Let's just do fast notes on how to do a Doppler scan. Okay, so here we start at the inguinal ligament, right, and then we place our probe TS, right, or transverse section, right, and then we can see here the femoral confluence, right here, where the deep vein and the great saphenous vein pour into the, or drain into the femoral vein. Okay. First thing we're going to see here is the Mickey Mouse sign. Again, as we said, Mickey Mouse sign is made out of the femoral vein, femoral artery, and great saphenous vein, right? And then we move alongside the medial side of the thigh. The thigh or the whole leg is placed in external rotation, so the hip joint is externally rotated, right, so that the knee of the patient is to the lateral side, right, so it's easy for us to scan the medial side of the thigh. So we move alongside the medial side of the thigh with the femoral vein and in each section we make sure that's compressible, and then we get here to the area here medially. It's medial right here, right? It gets very deep, right? So it's very hard to compress the femoral artery and femoral veins, right here, because as you can see it's very deep. If you compress with the probe here medially, it's very hard to get to the femoral vein to compress on the bone, so it's easier to compress it from posteriorly, right? So we place the probe posteriorly on the popliteal veins, and then we go up to trace again the femoral vein and then compress it on the bone posteriorly, because it's easier to do that, right? So when it gets to the adductor canal, it's harder to compress it medially, so we get to the popliteal vein, view the popliteal vein, behind the knee, and then we move upwards to trace the femoral vein and then compress it on the femur, right, to test the compressibility. Okay, and then we get to the calf muscles, right? Maybe before the calf muscles, we trace them from below because it's easier, right? So here is the anterior tibial artery. So in the calf muscles, they're very hard to view if they are normal and not dilated, and they're not thrombosed. So it's very hard to view them. So what we do is that we look for the artery, we look for a pulsating structure, right? So if we're looking for, we look for the anterior tibial, we place the probe TS on the base of the foot anteriorly, right? And then when we view the artery, anterior artery, which is pulsating, we look for congruent two congruent structures, which will be our veins, right? And then we trace it upwards into the calf or the leg, and then looking for the posterior tibial, we place for the posterior tibial, we place the probe TS again, right, below and posterior to the medial malleus. So the medial malleus below and posterior, right? Here is the posterior tibial, right? And then we run alongside it. We try to view two structures congruent to it, which are going to be our veins along the calf muscles, right? So basically, this is the Doppler scan. The anatomy of the veins and Doppler scan in summary.